I'm Dr. Stu, I'm both certified family medicine and sports medicine doctor. Welcome to part 2. So by this time you should be able to do phase 1 and phase 2 without any pain. Let's say if you still have ongoing pain, I'll recommend to stick with phase 2 and maybe also talk with your doctor to see if there are any other treatment options before you can progress on to phase 3 and phase 4, which is what we're going to do in this video. So basically in this video we'll be adding load, we'll be adding more like challenging dynamic stability exercises to make sure that we strengthen this rotator cuff tendon so that this injury never comes back. So welcome to phase 3. The first exercise is the same exercise that we did in phase 1, the thoracic spine extension mobility exercise. For phase 3, I would recommend sticking with foam roller. I feel like it's far more beneficial compared to just the towel. And again, you can get these foam rollers cheap in Walmart or other places for less than $10. So same thing, just a quick recap. Going to put the foam roller right at the mid upper back, and then using your hands to support your head, you're just going to enhance the extension of the thoracic spine, opening up the chest, holding for 3 to 5 seconds, and then come back. So I would try to roll the foam roller, just kind of like go a little bit down, probably around like an inch or so, and then again hold that hold that stretch for 3 to 5 seconds, and then come back. Okay, so I recommend doing anywhere between 8 to 10 repetitions to start to finish this exercise. So next exercise is called the side lying external rotation. For this exercise, you need a towel, and you need probably anywhere between like 2 pound all the way up to like 7.5 pound dumbbell, depending on your strength. So what we're going to do is that we're going to lay on our side, okay, and then we're going to put a towel right between the arm and the rib cage like this, okay. So now your elbow is right at 90-degree angle, okay. So now I'm going to grab the dumbbell, okay, and now we're going to focus on strengthening our external rotator muscles. So we're going to lift this dumbbell up all the way, okay, and then come back down slowly. So that's like 1, that's 2. So this exercise you'll feel a lot of like burning, fatiguing as you keep moving with this exercise. The key is to make sure that you're bringing it up and then come back slow. So 100, 200, 300, again up, again 100, 200, 300, okay? So I would do anywhere between 10 to 20 repetitions depending on your strength. So right now, I don't know, I'm probably might be at like 9 repetitions or so, and I can feel like it's already kind of like burning and fatiguing right now. So depending on your strength, start with like 2 pound dumbbell and then move up to like 7 pound, 5 pound, 7 pound, 10 pound, depending on your strength. So I would do each side 2 to 3 sets, around anywhere between 15 to 20 repetitions. So the next exercise is called as the standing band rows. So again, for this exercise, we're going to use the resistance band like before. So I'm going to loop the resistance band on a doorknob. I'm going to walk away a little bit so that I create a tension in that resistance band. So maybe probably start here. So now here, again, I'm not pulling the shoulder up, okay? I'm pulling it close to my right at the abdomen, right at that the rib cage and the abdomen joining level, okay? So the goal is not to shrug your shoulder. The same thing, the goal is to keep the shoulder down, okay? So the shoulder away from the ears, and then bring it all the way close, hold that contraction for 2 to 3 seconds, and then go back down slowly. Again, 1, again, slow release, or slowly letting it go. Again, 1, again, slowly letting it go, okay? So I would do anywhere between like 10 to 15 repetitions, depending on the resistance bands that you choose. I recommend doing like anywhere between like 2 to 3 sets, okay? Remember, no shrugging, okay? Keep the shoulder down, focus on that, and then hold that squeeze, and then come back down. Again, all the way out, all the way close to your abdomen, hold that squeeze, and then come back down. Okay, great. So next exercise is called as the IWY burner. Great exercise, okay? So remember we did the prone extension exercise. So that's what I call it as I. We did that in phase 2. And then we're going to combine W and then we're going to combine Y. So similarly, I'm going to show you in the back view and the side view first before doing it on the floor, okay? For the I, so remember, recap in phase 2, we're going to keep that, we're going to keep the palm facing the floor. So we're going to keep it like this. We're going to keep the shoulders tucked down, squeeze the shoulder blade, and then lift back, and then back to the starting position. So on the side view, it's going to look like this. So bring the shoulder down, squeeze the shoulder blade, lift up like this, hold for like 3 to 5 seconds, and then come back down, relax, okay? So that's I. So for W, we're going to do same thing. We're going to keep the shoulder in a W position here, keep that shoulder tucked down, so not shrug. We're not shrugging your shoulder, we're keeping it down, and then lift up a little bit, and then come back down, okay? Same thing. On the side view, again, W position, we're going to keep that shoulder down, and then we're going to lift up a little bit, and then come back down, okay? So that's I, W. Now Y. For Y, or you also call it as a V, so we're going to keep our thumbs up like this, okay? And then, same thing, we're going to keep that shoulder depressed down, not shrugging the shoulder. We're going to keep the shoulder down, and then lift up a little bit, and then come back down, okay? Same way on this side here. Similarly, V, we're going to keep the shoulder down, lift up a little bit, and come back down. Remember, I'm not lifting up like this, just a slight lift, and then come back down. And you'll probably appreciate more when we do it on the floor, okay? So let's do that exercise on the floor. So remember, you need a towel, similarly, so that you're not lifting your neck, and also your neck is, your head is supported as you do this exercise. So let me come here, okay. So we're going to put my head down on my neck like this, okay. So let's start with our I first, okay. So same thing, so we're going to bring the shoulder down, so depressing, not shrugging, so depressing it down, and then I'm going to squeeze my shoulder blade, and then I'm going to lift up, so, and then 100, 200, 300, 400, 500, relax. Again, bring your shoulder down, squeeze your shoulder blade, and then lift up, 100, 200, 300, 400, 500, relax, okay? So that's I. So then we have the W. Again, keeping your shoulder down, so not shrugging my shoulder like this. I'm keeping it down. Again, lift up, 100, 200, 300, 400, 500, relax. Again, keeping the shoulder down, lift up, 100, 200, 300, 400, 500, relax, okay? And now the last position, your Y. So keeping your thumbs up like this, okay? So don't shrug your shoulder like that, rather keep the shoulder down. So think about, like, instead of doing this, so think about long neck. So you want your long neck, you don't want to shrug and make it short neck. You want to make it long neck, and then you lift up slightly off the ground, and then hold 100, 200, 300, 400, 500, relax. Again, bring the shoulder down, and then lift up 100, 200, 300, 400, 500, relax. Okay, so we'll do 3 to 5 repetitions for each. So for I, 3 to 5 repetitions. For W, 3 to 5 repetitions. For Y, 3 to 5 repetitions. And we'll do that anywhere between 2 to 3 sets. So next exercise is called as the Serratus push. And it has 3 progressions just on this exercise itself. The first one is the level 1, the wall. And then we'll do the kneeling, and then we'll do the regular push-up variation. Okay. So for the wall Serratus push, so you're going to be on the same position as the wall push-up, except that we're not going to do the push-up. We're just only going to pinch our shoulder blade and then come back. So when you pinch your shoulder blade, you're dropping your chest and then come back. So again, so you can see the movement is not like a huge movement like this. My elbows are locked all the time, and instead just my chest is moving forward as I pinch the shoulder blade. I hold this contraction for 3 to 5 seconds and then come back. Again, my chest drops, my shoulder blade squeezes, and then I come back. So you can appreciate that small movement focusing on the serratus muscle. Again, same thing. Drop the chest as you squeeze the shoulder blade. Again, my elbows are locked. It's not my dropping the chest like this. My elbows are locked. It's just dropping the chest as you squeeze the shoulder blade and then come back. Okay. So for level 2, we're going to do the same, except that we're going to be in a kneeling push-up position right now. So same thing. So we're going to be in a kneeling push-up position. So let us say if I'm going to do a push-up like this, I'm going to do this, right? So instead, so what you're going to do is you're going to keep that elbows locked and your chest drops, your shoulders blade squeezes and then come back. Chest drop and then come back. Chest slight drop, shoulder blade squeeze and then come back. So you can see my elbow joint, it doesn't bend like this. It's locked all the way, except that my chest drops, squeezing the shoulder blade and then come back. Once that feels easier, then you go back to your regular push-up position like this, and same thing, my chest drops and then come back. So all you're doing is that you're squeezing your shoulder blade, your chest drops a little bit, and then hold for 3 to 5 seconds, and then come back. Again, chest drop, hold for 3 to 5 seconds, and then come back, okay? So I would do this exercise anywhere between 5 to 10 repetitions, and I would do it 2 to 3 sets. So consistency is key here. Do this routine anywhere between 3 to 4 times a week, at least minimum 3 times a week. And once you find this phase through is getting easier, then you're ready to move on to phase 4. So welcome to phase 4. We're going to add more load and more dynamic movement. And once you can pass these exercises without much pain, then you're pretty much ready for real life, okay? So the first exercise is active scaption. So it's the same exercise that we did in phase 3, except that we're going to do with a load with a dumbbell, okay? So remember, your elbows are pointed up like this, okay? So you're not this or you're not doing this. You're doing this, okay? So your elbows or your dumbbell is pointing up. So you're in a scaption phase, so go up like this and then come back down slowly. So that's 1 repetition, okay? So again, and then 1, 2, 3. Again, take anywhere between like 1 to 2 seconds to go up, and then again 1, 2, 3. So again, we're not going this way. We're not going this way. We're going somewhere in that V. So almost between around 30 to 45 degree angle, and then come back down. So I would do this exercise anywhere between 2 to 3 sets, 10 to 15 repetitions, and as you get stronger, you can start increasing the load on the dumbbell. So the next exercise is called as the prone angel swimmer. A great exercise. We're going to integrate that phase 3 exercise, the IWY, into one movement, okay? A great endurance exercise for your scapular muscles as well. So I'll show you similarly the back view, the side view, and then I'll show you the floor view. For the back view, so remember IWY, so similarly, we'll bring our shoulder down, so not shrug, down, and then our palms are facing towards the floor. So shoulder down, palms towards the floor, and then I'm going to squeeze my shoulder blade. I'm going to lift that shoulder up like this, and then I'll come to the W and then go to the Y, and then I point my thumbs up and then lift up a little bit and then come back down and then go back to my starting position and then done, okay? So I'll show you in the side view again one more time here. Similarly, we're going to squeeze the shoulder blade, we're going to depress the shoulder, so basically we're going to keep that shoulder away from the ears, and we're going to squeeze the shoulder blade, we're going to lift that shoulder up slightly up, and then we're going to come to the W and then the Y, and then thumbs pointing up, and then lift the shoulder up a little bit, and then come back down, and then come back to the starting position, and then we're done. So that counts as 1 repetition, okay? So now let's put that on the floor, okay? So I got my towel to support my head. So I'm going to put my towel on the floor. I'm going to put my forehead on the towel, okay? So starting position here, so the palms facing the floor, and I'm pretty relaxed. So now I'm going to bring my shoulder down, so not shrug, bring it down, okay? And then I'm going to squeeze my shoulder blade, and then my movement starts right now. So bring my shoulder up, okay? And then I make a W, and then come to a Y, and then my thumbs point up,
and then lift up a little bit, and then come back down, come to the W, come to the I, and then done. So that's 1 repetition. Again, 2, same thing, shoulder down, squeeze my shoulder blade, lift up, come to the W, come to the Y. Don't shrug your shoulder here, keep the shoulder depressed down, thumbs pointing up, lift up a little bit, come back down. That's 2. Let's do 1 more, okay? Same thing, shoulder down, squeeze your shoulder blade, lift up a little bit, come to the W, come to the Y, thumb pointing up a little bit, lift up a little bit, come back down, W, and then I, and then done, okay? So we will do this anywhere between 5 to 8 repetitions, anywhere between 2 to 3 sets. So next exercise is called as the push-up plus. So remember we did the serratus push on our phase 3. Now we're going to combine the whole thing as to one push-up exercise. So I would recommend starting with the kneeling push-up first, and then slowly progress onto the regular push-up. And let's say if you have to start with the wall push-up, you can start with the wall push-up as well. So I'll start with the kneeling. I'll show you the kneeling and the regular push-up, and it's going to be the same movement for the wall push-up as well. For the kneeling, so when I do a push-up, I'll probably start here and I'm doing a push-up. For this push-up plus, I'm coming all the way up. So almost my upper back is like pretty rounded. Instead of like starting here, I'm starting here. And then I'm doing 1 full push-up. So 1 and then back down, okay? So for few other key things to focus is we're not flaring up our shoulder. This is going to pinch our shoulder tendon and by causing pain. We don't want to tuck so close to focus that to focus only on the triceps that we will be fatiguing it. We're just going to be somewhere in the middle, okay? So same thing all the way up. So that's the plus version, and then come back down, and then up, and then all the way up. So again, you can see my upper back is pretty rounded. Again, come back down, and then all the way up, all the way. So not stop here, all the way up. Again, come back down. Again, a regular push-up, people might stop here. I want to come all the way. So keep your elbows fully straight, okay? So now, if you feel like this is easier, then you can do like a regular push-up. So similarly, I'm keeping my upper back is rounded all the way up, and coming back down, and then all the way up. Come back down, all the way up. Come back down, all the way up. Okay, so again, not start here, I'm starting like right here. Okay, so I recommend doing this anywhere between 2 to 3 sets, 16 to 15 repetitions depending on your strength. So next exercise is called as the tall plank shoulder taps. For this, again, you can start doing the kneeling version first, and then you can start considering the regular plank version. So for the kneeling version, so you're going to be on a kneeling position like this, okay? So your shoulders are pretty much like your hands are shoulder width apart, and then instead of like, you know, you're keeping that trunk straight in a straight line, not rotating, and then you're just going to tap. You're going to lift one hand up, and then you're going to tap on the other shoulder, and you will lift one hand up and tap on the other shoulder. So if I have to show in the front, it's going to be something like this. So 1, 2, 3, 4. Okay. So once this becomes easier, then you can go back to the normal plank version. So basically a full arm plank where you're keeping your shoulder, so your body is in straight line, and then the focus is once you keep your feet a little bit wider, you get a little bit more good balance to do this exercise. And then you're going to tap 1, 2, 3, 4, 5, 6, 7. Okay, so that's it. So you do this. Either you can start with the kneeling plank, kneeling shoulder taps, and then progress on to the regular plank shoulder taps. And then I'll recommend doing anywhere between like 2 to 3 sets,
anywhere between 6 to 15 repetitions depending on your strength. So the last exercise is side plank. So we'll start with kneeling side plank and then go on to the a little bit modified regular side plank and then a regular side plank. So for the kneeling side plank, you're going to lay on your side, your legs are bent, and then think about, like, you know, basically you're not just supporting your weight just on the shoulder, you're actively trying to push the floor away using your shoulder. Okay, so you're going to start with a plank position, so keeping your bring your hips up, your head and your knee all in a straight line, and then I'm going to hold this position for anywhere between 30 to 60 seconds. So imagine, instead of like just holding, imagine just holding the weight on your shoulder, you're just actively trying to push that floor away from you, and thereby you're keeping that you're able to hold the body in a straight line. Once this becomes easier, then you can do a modified side plank where you bring one leg, you put one leg in the front and one leg in the back, and then you're actively holding that position for anywhere between 30 to 60 seconds. And once that becomes easier, then you go on to a regular side plank, and again make sure that your head and your whole trunk is in a straight line, and you hold this contraction anywhere between like 30 to 60 seconds. So I would do this exercise anywhere between 2 to 3 sets, holding contraction for 30 to 60 seconds. And there you have it. Remember, tendons heal slowly, often taking 12 weeks or more. Be patient, stick to the phase that matches your pain level, and prioritize perfect form over heavy weight. I hope this video is helpful. If you have any questions or comments, please post in the comment box below. If you found this video helpful, please make sure that you put some appreciated comments in the comment box below. That'll really help out my channel as well. If you want to be notified of more evidence-based rehabilitation videos just like this, please make sure to hit the notification button and the subscribe button as well. And I'll see you in the next video. Until then, goodbye.